All right, excellent. Am I ready to go? All right. Good evening, family child care providers and partners. I'm going to ask you to please make sure that you're on mute. Thank you. All right, so we're going to go ahead and get started. Thank you so much for taking time to join us this evening. I realize that it's probably been a very busy day. And we really do appreciate you taking some time out of your busy schedule to join us and allow us to fill you in on some updates of things that are happening here at our EEC as an agency and as caregivers as wholes. And so I want to take some time to shout out my Family Child Care Region 3 team. But before I do that, I guess I should tell you, for those of you who don't know, my name is Maria Martinez. And I am the regional director here in the Lawrence office. And I am fortunate enough to have a wonderful, hardworking group of family child care licensors. And some of them are on the call today, or on the Zoom today, along with some of our central colleagues. And I want to make sure to shout them out. We'll start with Sarah, who is co-hosting with me this evening. I don't want to forget her like I did this morning. She's my co-pilot, but truth be told, she's really the pilot. And so I appreciate her being on tonight and helping me navigate. We've got Jocelyn too from Central, and you'll hear from her later on. She has some exciting updates to share on the financing. My licensing team, we've got Karen Brown, the Family Child Care Supervisor, here tonight. I know many of you know Karen. We've got Moni Dara is also here tonight. We've got Johanna. Johanna is on the call tonight. We've got Eliliana. We've got Celeste. We've got Yesenia. And we've got Lucy. I think that's everyone. Everyone is here tonight. So thank you so much.
Maristela.
No forgetting Maristella. I forgot Stella. I didn't see you. My apologies. Maristella is in the house. She's here as well. So thank you so much. All of the team is here tonight. So thank you again for taking time to be on tonight. We have BRC here as well. We've got Megan. Thank you, Megan. We've got Brandon. And then we've also got Jody Dominguez, our QRIS specialist, is on the call tonight as well. And we've got Lisa Cheney, and I tripped over her title this morning, and I'll probably trip on it again. Community Family Quality Specialist. Say that 5 times if you can. And so thank you so much for joining us, EEC team. I really do appreciate you being on tonight. If I missed anyone, please forgive me. That's why I allowed you to come in sooner so I could see who was trickling in. So thank you so much. All right. So having said that, what I wanted to do was let you know the agenda for tonight. So why don't we go ahead and, perfect. Thanks, Sarah. All right, so tonight we are going to have our professional development centers update us on everything going on with them and with US programs and the services that they're offering in our region. We will go through some general EEC updates, some really important things to remind you of or to clarify. We're going to do that tonight. We're going to do a health and safety review and discuss some upcoming changes. Some of them you've been patiently waiting for, so I'm happy to be able to share that with you tonight. We're going to do some EEC policy updates as well. And then I'm going to pass it over to Jocelyn. We're going to flip tonight, and Jocelyn is going to go first. She's going to update us on some financing information and some feedback. And then Sarah will close out with some licensing regulation engagement updates. We have a jam-packed agenda. I do want to let you know it is being recorded. And so we are going to be referring to some policies, and we're going to be referring to some links. And I want you to know that this is all going to be available to you in the engagement portal at some time after tonight's town hall. So just keep that in mind. I don't want you to think that you have to be taking snapshots, pictures of any of the slides. We're going to make it all available to you. So just sit back and enjoy the updates. All right. All right. So what we want to do is we want to go ahead and pass it over to Luisana Lizardo. She can also introduce anyone else from the professional development centers that might be here tonight. Luisana, take it away.
Hello, everyone, and thank you, Maria.
My name is Luisana Lizardo. I am the manager of the Northeast Professional Development Center. We are one of the 5 professional development centers in the state. Some of our team members are here as well. Rosa James here, Wendy Fournier, Marianne Roman, our lead coach, and Catherine Perez. The Northeast Professional Development Center provides support and service to early childcare educators and program administrators in this region. Overall, all the 5 professional development centers in the state provide service, but our purpose is to provide free, high quality professional learning at statewide and local level in English, Cantonese, Portuguese, and Spanish. We offer trainings and professional learning communities, or PLCs. PLCs are multi-sessions events that provide an opportunity for groups of educators and administrators to share expertise, test new strategies, join a community, and enhance program quality. Also, it gives them the opportunity to improve learning experiences for children. PLCs tap into the expertise of the participants and offer an opportunity to meet and learn from other educators in your region. The Northeast Professional Development Center offers services in English and Spanish. We have full-time coaches that are fully bilingual. Registration is available at eecstrongstar.org. Some of the topics available this month are using developmentally appropriate experiences and activities to promote children's social and emotional development. We also have a program operations PLC. It covers understanding and implementing the EEC health and safety requirements. We also have another brand new PLC called Leading for Change. Could you please go to the next slide? Okay. So in addition to professional learning communities, we also offer coaching and one-on-one consultations. Educators and administrators from all program types can request to work with a qualified coach who will focus on supporting you in many different areas. The focus of your service will be determined based on the individual and unique program needs. PDC coaches are early childhood and out of school time experts who can support your program in many different ways, including reopening and operating during the COVID-19, business practices, business administration, staff professional development needs, staff well-being, and workplace culture. Here at the PDC, at the Northeast PDC, we have piloted several mentoring cohorts. Two of those cohorts were available to family childcare providers in this region. We had a curriculum mentoring cohort, and we also had an environment cohort. During the meetings, family childcare providers were able to discuss and learn how to implement curriculum in their program. In the environment mentoring cohort, family childcare providers were able to explore ways to organize their space, to ensure that they have the materials they need. They also review ECRs and FECRs, and a self-assessment of the space was completed at the end of the cohort. They met bi-weekly, and coaches were able to offer trainings on specific topics based on the needs of the group. Participants were also able to receive up to 20 hours of one-on-one individual coaching. So I highly recommend you to look at our website and explore the different PLCs that we offer every month. The content is new every month. We have a brand new calendar that gets posted every month in our website. And again, the services are free and the coaches are available to assist you. You can contact the Northeast Professional Development Center and request one-on-one coaching and consultation by calling us directly. Our contact information is available in the COVID-19 playbook. And also our contact information is available on the EEC Strong Star website. If you're on Facebook, you can also visit our Facebook page. And thank you.
Maria, you're on mute.
Sorry about that. Take advantage of the training opportunities. There's some really great trainings out there. The PDC has done a great job at making sure that they offer trainings that are going to be that are going to be able to help you navigate the new landscape, right, based on what we're currently living through. So please take the opportunity, if you haven't already done so, go ahead and go to their website and look at what they are offering. There really is a huge array of offerings, and all of them, I believe, if not most of them, are virtual offerings. So now is the time to take advantage of what's being offered. And I have a saying, if it's free, it's for me. I don't know if you guys feel the same way, but if it's free, take advantage of it while we can. Thank you, Luisana. All right, so we will go on and discuss now our general updates. So we'll start with our COVID-19 testing sites. As many of you have probably already heard, we have 3 sites now that are open 6 days a week from Monday to Saturday. Those are the Braintree, the Swansea, and the new site in Tewksbury. The new site is in place now of Billerica. So Billerica is no longer offering the test, but Tewksbury is offering them. All the sites are open from 10 to 6. And there's no pre-registration needed. So, you don't need to pre-register for the testing. Turnaround times now are between 24 and 48 hours, which is wonderful. We know that in the beginning there were some challenges, and we're pretty proud of how quickly Sarah and everybody up at Central were able to work to iron out the kinks and get to where we are today. So 24 to 48 hour turnaround time. And the labs are here in Massachusetts, the lab, which is terrific as well. So COVID-19 tests available, 2 programs. Make sure you're taking advantage of that. Supplemental PPE. So we wanted to share some stats with you, some data with you. There has been 10,500 orders that have been placed since February. 100% of the February and March orders have been delivered. And so if you order by the 5th of the month, you are guaranteed a delivery during that month. After the 5th, we make no promises, or they make no promises. Order limits and contact information are on the LEAD portal. So make sure if you have any questions, that's the place to go for information. And EEC is committed to providing supplemental PPE through the end of June, and we'll revisit the need as the need persists. So more to come on that, but I did want to update you. We did want to update you on the PPE. Sarah is manning the chat, and she is putting in some helpful links in there. So make sure that you're checking. I forgot to tell you all that we have a jam-packed agenda, and it could be that we will not have time to take questions at the end, but please know that Sarah is there. If she can answer questions now live, she will. If not, she may ask you for an email address so that we can circle back around and make sure to get you an answer to your question. All right, some more updates. COVID-19 vaccine. People eligible in the child care worker group include anyone working in or supporting in-person childcare. So we know now that our turn is up and we can go out and get our vaccines. The worker group that qualifies right now is FCC educators, assistants, center-based educators, staff, individuals supporting programs like your transportation drivers and your custodial staff, and FCC household members. You can use the mass pre-registration system to be notified when an appointment at a mass vac site is available. So again, services that are available to you, Commissioner has worked really hard to make sure that we get these. And as many of you may already know, and if not, I will update you today. On March 22nd, the governor updated the travel order. It then became a travel advisory. And so the travel advisory encourages travelers to quarantine for 10 days. We've gotten a lot of questions as to whether or not programs can create their own policies for a return back to the program after traveling outside of Massachusetts. You should communicate with your families, your expectations as a program, and you can create your own return to care policy for out-of-state travel. Just make sure that your communication with the parents is really clear, that you make your expectations clear. All fully vaccinated adults and children under 10 years of age are exempt from the advisory. So just some, quick updates on the travel advisory. All right. And now some upcoming changes that I can share with you tonight. EEC is in the process of updating the minimum requirements and the playbook, and those are going to be released sometime this month. So be on the lookout for that. The revised requirements are going to increase flexibility for programs when proper health and safety protocols remain in place. It's going to optimize the availability of outdoor activities during the spring, summer, and early fall. We've listened to everything that you have told us. We've taken best practices. All of it is being considered. They are currently working on a revision, and that is coming this month. So be on the lookout for it. The strategies that you are using as programs right now are working. So now is not the time to get too relaxed or to abandon the strategies that have proven to work, right? That have proven to keep children and educators safe. So please continue to take your precautionary measures and continue to look for us and for the updated minimum requirements and playbook update, which we expect to roll out sometime this month in April. Awesome. All right. Another hot topic in this region, and I know because I get them all, is reporting, right? When to report when there's been a positive in your program, when to report when there has been an exposure, when to report any incident to EEC. And so we thought that we would spend a little bit of time tonight updating you, clarifying things that have come, questions that have come from the field. Reporting positive cases and exposures continues to be a very critical part of stopping the spread of this virus. The playbook includes instructions on how to report positive COVID-19 tests and close contacts. When a child, household member of a child, educator, or staff in a program tests positive, you have to submit 2 reports. You need to submit the COVID positive report with DPH, which is accessible right there in your LEAD portal. And you also need to submit an EEC incident injury report. So you got to make sure you're doing both of those. For a close contact, only an EEC report is required. So you do not need to do the DPH for a close contact. You just need to let EEC know through the report, through the incident report in your portal. An EEC report is not required if someone in the program simply has symptoms without a known exposure. Okay, so we just wanted to make that clear. And so we also wanted to flag with you that follow-up events. So what we're describing or defining as a follow-up event is a positive related to an already reported case. So let me break it down a little bit more. You have a positive case in your program. And from that positive, you now have 2 more positives. Do you create 2 more cases? Or do you revise your current case? The answer is you revise the current case. You update the current case. You do not need to create another case for the same exposure. I hope that's clear enough. And if it's not, when in doubt, you can always reach out to your licensor, CC the supervisor, CC me, we will get you the answer. But I want to make it clear because we're spending a lot of time reviewing duplicate cases, which takes our eyes off of other things. And so by clarifying this with the field, we're hoping that it'll reduce the number of duplicate cases. So if you have 1 positive, and from that 1 positive, you now get 2 more positives, you can put all those 3 into 1 case. If you've already created the case, you can go in and revise it, update it. If you have a problem doing that, reach out to us so that we can help you. All right, closures. Thank you so much to everybody who's working so hard to make sure that I get your closure requests through your licensors. We really are working as a team. I want you to know that I'm not standing behind the computer processing these on my own. Your licensors are flagging me every day, morning, noon, and night. Yes, absolutely. And we're working really, really hard to, well, I'm working really, really hard to make sure you get that approval letter as quickly as possible. We have worked with programs to make sure you know what information we need so that we can eliminate the need to go back and forth before you can actually get a letter. And so thank you so much to the licensing, but thank you so much to you as well for making sure that you are taking all of the steps necessary in order to be able to get your closure approval. EEC recently updated the closure policy for programs receiving subsidy payments to reflect new realities of programs operations and clarify some of the expectations. That's already been released. It's on our website, but we are also going to make sure that it is part of the appendix of this PowerPoint presentation, and that is going to be available to you in the engagement portal sometime after tonight. So be on the lookout for that. But we did want to hit some key points of that policy. As a reminder, programs can receive subsidy payments for closures due to things like sick staff members or children and the need to perform deep cleaning. And most of you know this. I'm receiving your requests. The update clarifies that programs may be paid for closures related to administering the COVID-19 vaccine that results in short-term side effects of getting the vaccine. So just make sure that you're connecting with us so that we can talk you through what is an approved closure. And one of the great things is that for closures less than 3 days, so 3 days or fewer, you no longer need the approval letter from the regional director. Now, that doesn't absolve you from having to go in and create the case in lead and the incident report in lead and notify us of the exposure or of the positive. But it takes one step away because you no longer have to wait for an approval from the RD, then submit it to your system or submit it to your local resource and referral agency in order to get paid. So for closures of 3 days or less, you no longer need the regional director approval. All right. Some updates from our sister agency and what it means for us, for EEC. There have been some updates from the Department of Elementary and Secondary Ed, DESE as we call them. As you know, they have gone back to in-person instruction and transportation. DESE required all of their elementary schools to provide full-time in-person instruction beginning April 5th. Some kids are already there and some are starting April 28th, I believe. And then you have some that requested to start in May. EEC's policies have not changed with regards to remote instruction. We wanted to make sure to be able to support program needs and community needs, family and children needs. And so we're not making any change. We are still going to serve school-age children during the school day if remote instruction is allowed by their school district. Subsidy policy regarding remote and hybrid instruction has not changed. It will not change. So as of right now, we will continue to support remote instruction if the school district has been allowed to continue. Updates on EEC's transportation policy. We did have an update on that. We basically aligned it with DESE for both school buses and vans. So it states that all adults and children 5 years old and older must wear masks at all times while on transportation and do not have to maintain the physical distance. Proper ventilation is also required. So we basically aligned our policy with DESE's. However, we want to make sure that you know that best practice is still to maintain that physical distancing even when all parties are masked. So we continue to strongly encourage as an EEC, as an agency, the masking and the social distancing as much as possible on transportation vehicles. If you don't know yet, there was a subsidy rate increase that was approved at the March board meeting. The increase is going to be implemented by May 1st, and it's going to be retroactive to July 2020. EEC encourages that the funds associated with this increase in transportation be used for transportation purposes. EEC has posted rate increase documents in CCFA, and CCR&Rs will send a notification to center-based providers with more details. I leave that in there because some of you run dual programs, and I want to make sure that you are hearing this multiple times. The other thing that we wanted to announce is that family child care providers providing care to children with subsidized tuition are now eligible to participate in the Mass Paid Family and Medical Leave Program. Eligible providers can apply for it through the Department of Family and Medical Leave. If you plan on taking it, you need to notify your licensor at least 30 days before the first day of that leave. And if you need to take it unexpectedly, then you should notify your licensor as soon as possible. There's going to be more information, again, on each of these policies and links that are going to be available at the end of this presentation and will be accessible to you through the engagement portal. Right? So the engagement portal, the strategic action plan portal, these are all things that have made it a lot more easier for you as the workforce to be able to engage with EEC and let your voice be heard. And we wanted to share some of the stats. To date, we've had 21 live opportunities offered, 8 surveys gathering over 2,000 responses. We've had 33,000 page views at the strategic engagement portal. We've had 4,684 registrants across all events, and we've had 13,000 unique visitors to the strategic engagement portal. So some good numbers there. That QR code, that code in the middle, if you were to open up your cell phone camera and hone in on that, that would open up a page on your web browser, and it would bring you directly to the strategic plan portal. So just some things we've learned along the way from Sarah Toast, and I wanted to make sure to share that with you. So you don't have to do it now, but maybe later on when you go into the engagement portal and you want to see all these handouts, you may want to test it. So just wanted to put that out there. Some more things that you should know. In February, we launched the past engagements page, which has recordings of all live events, summaries of survey results, and downloadable resources that are shared during events. It's pretty cool. I was actually in there before joining the session tonight, and it's very user-friendly, very easy to get to. So if you missed anything, you have the opportunity to go in there and catch the recording afterwards. There are the results from the February and March surveys that are going to be posted there soon. They're not there yet, but they are coming. And this is also where we will post a recording of this event, tonight's event, as well as the presentation. So check back often for new content, check back often to see what engagement opportunities are out there so that you could be present and let your voice be heard. All right. So next steps for engagement. We're going to be pausing all our live engagement for the rest of the month of April. This is going to allow us time to digest what we've already had shared with us. And then we want to also work on incorporating the feedback that we've received into the development of some of the initiatives. You can use the past engagements page to catch up on events you couldn't attend live, review the survey results, and then come back ready with more feedback in the next round. So for now, we're pausing, but we'll be back soon enough to allow you time to participate and be able to share in the decision-making processes. We still need your voice, and you should be on the lookout for new opportunities at the end of April through May. Oh, okay, well, and so that's my updates. That's my part of the presentation. I am happy to pass it over to Jocelyn, who is going to update us on funding and financing. Jocelyn, take it away.
Thanks, Maria. It's great to be here tonight to talk about this topic that I mentioned a few people might be interested in. So we have a couple of funding opportunities coming up over the next few months that I just wanted to make sure everybody was aware of. The first is our operational grants opportunity. This is a state-funded grant that is coming in 2 types for different different program types. The center-based version is focused on workforce grants and is available to center-based programs within the subsidy system to address current staffing issues that we've heard a fair amount about over the last few months. To be eligible, a program has to have served at least one subsidized child since July 1st, 2018, so at some point over the last couple of years. And the funds have to be used to support staff. You can think about hazard pay, signing bonuses to hire new staff, or paying out unused PTO. The family childcare version are the facilities grant, and these will be available to all family childcare providers to address health and safety program investments or quality enhancements. And FCCs can reimburse themselves for improvements that you've already made or invest in new upgrades to support health and safety protocols. In terms of timeline, we're currently working with PCG to get an online application up and running. The application will be a separate online application. This is not going to be run through Combis. And as soon as that is open, we will start paying programs on a rolling basis through the month of May. The second opportunity that we have available are the stabilization grants. So this is our the first stage of a series of stabilization grants using the federal funds. And these will become available after the operational grants. We have been waiting for the legislature to appropriate the funds to EEC so that we can spend them. The stabilization grants will be available to support all programs and will disperse funds through a formula, which we're calling the Commonwealth Cares for Children, or C3 formula. And this is currently in development, but I'll share a little bit about our thinking right now in a few minutes. But we did have a live engagement session focused solely on this work, and there is a recording of that on the past engagement page. This was back at the beginning of March. In terms of timelines, we're currently working on the formula with the idea of having mid-spring, having a strong draft formula available for feedback, and looking ahead, planning to distribute funds in potentially monthly payments to programs through the summer and potentially into the fall. And this work is being done in partnership with a team from third sector. We actually began this work back prior to the pandemic. In the first stage of the strategic action planning, we were thinking about how to effectively fund our efforts to build a backbone for quality, and recognizing that program-focused funding that didn't depend on child-level enrollment was going to be an important feature of that. With COVID, it's only reinforced the necessity for improving program financial stability and the need to stabilize day-to-day operations of early education and care programs so that programs are then able to focus on building quality. As part of this process, we are conducting outreach. It's a lot of feedback from the field is very important for us to ensure that we design a formula that will equitably distribute the federal relief funds. Stakeholder engagement is central to the design process, and our goal is to have diverse stakeholders participating and supporting EEC in answering both thinking about what is the best way to structure funding in the immediate term, and then how can this approach evolve into new support for the field over time. So this isn't just a short-term project. We're thinking about doing this in stages and continuing the funding as we have federal funds to use. We want to ensure that the formula does not leave out any group of providers. And we are using a range of opportunities like this one to provide information on the formula and solicit feedback to inform how it's structured and delivered. And although we will not have a live Q&A tonight, please feel free to include your questions or comments in the chat. And then in May, we plan to reconvene a larger session focused on this topic with a live Q&A to get further feedback. So to give you a sense of where our thinking is on this topic, here's the next two slides give an overview, but as a reminder, this is still very much subject to change. We're really in mid-development, and things that I've shared now may be different the next time you hear about this. But at the moment, for this first round, we have approximately 100 million available in federal funds for our first round of investment. We plan to distribute this in multiple payments, potentially monthly stipends to programs, and the funding amounts will be determined by a formula. It's important to know that this funding operates in addition to current state funding, so this is not replacing subsidies. Subsidies will continue as they have been, and any changes in developments to that will happen separately from the development of this formula-based funding model. So here's where we are with the formula. Our goals are to have a base amount that covers a relatively standard percentage of the cost of care for each program, and then to build on adjustments that are meant to advance EEC's priorities of equitable distribution of funds, increasing early educator pay, and then encouraging the delivery of high quality care. So for the base amount, this would be available to all programs that are open, and it will be scaled based on license capacity, because obviously larger programs cost more to run. Although on the FCC side, I think some questions have been raised about how much of a differential there is. It also will be adjusted to reflect differences in the cost of care across setting types. So recognizing the different cost models for different types of programs, regions of the state, and also the age group of children served, again, recognizing that infant toddlers are more expensive to serve than school-age children, for example. In thinking about adjustments, we are looking at ways to ensure that we are investing in programs that are located in under-resourced communities. Right now, we're looking at the CDC Social Vulnerability Index, which is a way which effectively rates communities based on a number of indicators, not just income levels, but also other indicators related to access to employment and other local opportunities. We are also interested in identifying a way to appropriately scale the formula so that it supports programs that are focused on increasing early educator compensation or hiring additional educators. So in a center basis, be thinking about if you could have 3 teachers rather than 2 teachers in the classroom. I think one thing that we recognize and are very interested in hearing from the FCC perspective is how we should be thinking about this on the FCC front. So, ways we can be thinking about attending to your efforts to invest in your own professional development, desire to hire an assistant and supporting that. We're really open to thinking about this, but fundamentally the goal of this component is to recognize an investment in educators is building the foundation of quality. The educators in a program are the cornerstone of the quality, and that investment is the first focus that we want to have in the quality component of this grant. And that little box here just notes that we want to continue to talk about this issue with the field in particular. So thank you. That is the overview to date, and I'll turn it over to Sarah Test to talk about the regulation work we've done.
Awesome. Thank you so much, Jocelyn. And I know it's 7:40 at night, and what everybody wants to do at 7:40 on a Thursday night is listen to somebody drone on about regulations and policies. So I am going to try to make this quick, but still explain what it is that we have to shoot today. So first, I just want to say thank you to everybody that showed up tonight, and to all of you who have shown up at these engagement sessions that we've been having over the past few months. What I'm about to show you is is an update on where we are in our thinking, everything that we've gathered so far. So I want to focus tonight just on kind of regulations and policies and what we're thinking in how we're going to format those moving forward. So important to note that regulations are the enforceable rules that child care programs have to follow. Changing regulations, as we're going through right now, and if you've participated in these engagement sessions, you'll know, is a long, drawn-out process, and they have to be done carefully. Policies, on the other hand, are much more malleable. They're easier to update, and they can be more, you can update them more regularly, essentially. So we want to make sure that we're leveraging each of these, basically these 2 resources or these 2 tools that we have effectively to support programs. And so clearly there's an interplay between regulations and policies. And specifically, we want the policies to be able to help us promote accountability and identify parameters around anomalies and be responsive to the different needs of programs at each turn. So moving ahead. So one thing that we are thinking about as we're going through our regulatory changes, it's a really great opportunity for us to really customize the regulations. And that is one thing that we have been hearing so clearly through the engagement sessions. The biggest piece of feedback that we've heard is that we need to differentiate regulations by program type. So what you're looking at now is an example of what that might look like in the finished product. So we're envisioning a format that would have the same general topics across all program types. So here you can see we're talking about regulations regarding daily schedule, but that the specifics of each one would be different. So, and it would be based on whatever the specific, whatever the setting and the program type is. So clearly, the daily schedule in a family childcare looks slightly different than a daily schedule in a center-based program. And certainly both of those look different from the daily schedule in an out-of-school time program. And so accounting for those in the different sets of regulations is what we are trying to pursue. We are trying to build this vision and infuse it with quality everywhere. So some of this on this page might look familiar to you in the context of the environmental rating scales, if you've seen those before. And just to note that we are trying to norm with other national standards as we redesign and think about each program type. So now moving on a little bit to educator regulations. Clearly, licensing regulations are really about the licensee, about the program being able to obtain and maintain a program license. But educator regulations clearly are about an individual, a person, not a program specifically. So the educator regulations will largely be about how an individual educator can obtain and maintain their individual qualifications to work in a program. Currently, the process involves BRC, it involves pre-service training, like EEC essentials, maybe first aid, CPR. From that perspective, it's the program's responsibility to ensure that the individuals who are hired meet those criteria and can work effectively with children. But on the educator side, we're thinking more about what those things are that the program should be looking for. And what we really want to do is recognize that there are many different pathways that can lead to high quality teaching in an early childhood setting. And it's a great opportunity also for the state to communicate those expectations around professional competencies, especially as we look to credentialing and what's going to be applicable to all professionals, regardless of where they work, where they are in their career, or what aspirations they have. And then last, but certainly not least, because this is one of the things that in all likelihood you'll get the most use out of as we move forward in the regulatory revisions, this is a brief glimpse into how we are thinking about actually physically putting together the regulations and the policies. So on the left-hand side here, you'll see a table of contents, which would essentially just be the table of contents listing out each of the regulations. But what we're excited about is what we have on the right-hand side. It's a supplemental resource. And the way we're thinking about structuring it is that each regulation would have its own. And it would be a summary of the regulation at the top. And then it would also have a section that would explain the rationale for why the regulation exists, essentially why it's important for this rule to exist for childcare programs. And then there would be related policies with any supplemental checklists or templates or anything supportive to the program that would need to be shared there. Part of this is because, as you heard Maria talk about earlier, the updated playbook. When we released the playbook last summer, we got pretty good feedback on it. And as we've revised it, we've gotten better feedback on it. And that idea of both providing the rules and the support to understand how to implement them is part of what's guiding us towards this new format, probably with fewer graphics though. So we are excited about this. Thank you for all of the feedback to date. And this is by no means the last time that you will be asked or have the opportunity to share your thoughts about where we're headed with the regulations. So please continue to engage with us. Keep your eyes on that strategic engagement portal where all of the opportunities are listed. We'll have more surveys and there'll be lots more opportunities coming up. So I'm going to go on mute. I'm going to turn it back over to Maria.
Great. Thank you so much, Sarah. And thank you, Jocelyn, for those updates. As you can see, you know, we're still moving really quickly. We're still aiming towards meeting all of those things that we set out to meet in our strategic plan. So we're busy. We know you're busy as well. And we thank you so much for taking time to join us tonight. I do want to remind you that the commissioner does send out a field email where she shares a lot of information. And if you're not getting those emails, please, I highly encourage you to sign up for them. Sarah is going to go ahead and put that link on the chat. Go ahead and sign up because that is a good place to start to be up to date on everything that is going on here with EEC. I want to take the opportunity again to thank you so much for taking time out of your busy schedule to join us tonight. We are here for you. I hope you know that, and I will continue to say it every time I get the chance. We are here to support you. We are here to partner with you. We are here to help you navigate the ever-changing landscape. So have a wonderful night. Thank you so much again for joining us. Be well. Bye.